especially a patient is having a heart attack where the LV function is really poor. So the indication, we call it as cardiogenic shock. It is like any other shock. Cardiogenic shock means your heart is at shock. Your heart is not trying to do anything, it is already failing, okay? Especially somebody who is having a heart attack, there is no blood supply to the coronary arteries. Here comes your picture here. What I need for this therapy, I need three things, okay? First, I should have a patient, or I should have some volunteer or patient, okay? Without a patient, I cannot do this therapy. And second thing is, I need this catheter, okay? This is the catheter which I was talking about, the balloon, which is going to go inside your body and inflate and deflate. So, when I am using the catheter, your part is like, we have a transducer here, okay? There are two ways to measure your blood pressure. So when you go to a doctor, he ties a cuff here, right? He ties a cuff here and he says your pressure is this much. But when you are sick, actually he doesn't measure your pressure. He puts something called as line. He pricks you. He pricks you, and that's called as an arterial pressure. Okay, we call it as invasive way of monitoring the blood pressure. There are two ways. One is non-invasive. Another one is invasive. When there is an invasive monitoring, you need a transducer. This is the one which is going to reflect your pressures into the monitor. What you need is, you need an infusion pack, hepsaline for anticoagulant. Here is the transducer which reflects your pressure. This is the catheter, and this catheter has a two lumen. One is for I'm going to inflate this balloon, right? What I'm going to use I'm going to use helium gas. Why I'm using a helium gas is like, helium is the low molecular weight gas. It's an inert gas. You could have seen a lot of balloons flying, right? They use a helium gas in that, okay? So why I'm using a helium gas is, if this balloon gets ruptured inside the body, okay, there is a lot of circulations going on. If I use a carbon dioxide, or if you use oxygen, it tends to form a large air emboli. But if I use a helium, it easily diffuses in the blood and nothing happens to the patient. That's why I'm using a helium gas for inflating. So you have a two lumen here. One is for sending your helium gas, another one is for monitoring your pressures. My colleague was saying that, see, you're going to take a class for the biomedical students, so they like the block diagram, but I don't have any clue about this diagram because I'm not a biomedical person. Maybe I'll leave it, the presentations here, you can go through. I'll just try to explain to some knowledge what I will see. You have a patient here, okay? You have a control strategy here, you have a monitor. So my signals has to pass from the patient to the monitor, okay? So the measurement of the physiological variables. Your physiological variables are not digital, okay? It has to be converted into the digital. So you have an analog and filters here which converts your physiological parameters into digital. And this control strategy also controls your pneumatic system. So I'm not sure how far you will be seeing this mission because it takes time for you, as I told you. This is a high-end therapy which is only used in the cardiac centers. When you go to the cardiac center, this therapy is very similar. You see this mission, IVP mission. This is the pneumatic system. This pneumatic system is very, very important. With this pneumatic system only, this entire pump is going to function. Okay. So this control strategy has a pneumatic system. It also controls a pneumatic system which has an inflation and deflation of the balloons. So this is how the intra-aortic balloon pump will look like. Okay. So why we are telling about this is, when you go to the hospital, when you see this, okay, you should have some knowledge. I'm not telling that you should be a master of intra-aortic balloon. Okay, there was some function called as Bioyantra. In SRM University, I've seen this mission. Okay. After this class, we will be having an hands-on also. So we'll try to explain something about this mission, how it works out, so that if you recollect something, it will be always better. Okay. So we have two pumps, CS300 and CardioSafe. What is the advantages? Like, we have a fiber optic module in this pump. So this is the front view and this is the rear view. This entire pump works by this pneumatic system. Okay, we have a helium gas which I told you. This is our pump, CardioSafe, which can be transported and it works on the digital signal processing. Okay. So the CardioSafe which I was telling you, see the hospitals in the lift and all, you don't have much space. Already to transfer a patient from ICU to theatre or from CCU to the theatre or in an ambulance, it is always a cumbersome procedure. Okay, so you should come out with a in the lift or in an air ambulance or in a road ambulance. Okay, So that's why we designed these kind of missions. See here, why we have put a young charming girl is that this girl itself can lift this equipment. Okay, it's only 24 kgs. So what we're trying to tell is like it's very lightweight, so it can be transported very easily. So let me tell you how this fiber optic technology works. Okay. See, this fiber optic technology is like in the catheter we have put a manometer here. Okay. As I was saying you, when you go to a doctor, when he measures earlier I'm not sure, earlier blood pressure monitor, you have seen sphygmomanometer. There is a mercury which is going on. You inflated mercury which is going on, right? There is a manometer there. So same thing, we have kept the manometer in the tip of the balloon itself. Okay, this is going to go inside the patient. So this tip of the manometer is reflected by a fiber optic cable. So a miniature manometer is mounted inside the intra-aortic balloon. What happens is that the light travels from this pump, okay, from this pneumatic system. The light travels from the pump through a fiber optic cable. I'll explain it to you. I don't know how far you can see. There is an orange cable here. So the light travels from the pump through the fiber optic cable, and the manometer responds to your arterial pressure. That's an in vivo calibration, in vivo pressures. Arterial pressure, it creates a light pattern, and then again it sends into the mission. That's how it translates the physiological parameters into the digital parameters. So this is the rear view of the mission. Okay. So where you have a pneumatic system. So fiber optic module is here. You measure the fiber optic in vivo blood pressures. Okay. And you have an IVP sensor. This is the input. Where you connect the catheter. You have an ECG. You have a pressure. So what are all you need? What are the triggers you need? You need an ECG and you need a blood pressure. As a biomedical engineers, you should know how an ECG is communicating from the patient to the monitor, and how blood pressure is transducers is communicating your physiological into the monitors. So what else we have is helium supply and data communication system. This is one which is the latest one. Like most of the hospitals are coming out with the hospital information system. So you should know how we connect the machine to your centralized unit. So all your data will be there in the thing. You have an RS-232 port, so you can collect all the data of the patient, and you can. It's like an MRD, medical records department. It's to a higher end. Okay, so you can collect all the data and save it in your console. So most of the hospitals are now asking for a hospital information system. So this is how the monitor will look like. You can see. So what and all I'm going to monitor is I'm going to monitor the ECG. I'm going to monitor the pressure, I'm going to monitor the IVP waveform. So when I'm doing a hands-on, I'll try to explain you each and every parameters what it is on. Okay. So this is the previous one which I showed you is only a monitor which you can see, and this is the operation. So where you can do the operation. So we have various operations like automatic, like your washing machine. You put in your automatic machines, everything the machine is done. Same thing with the IVP also. You put in automatic mode, everything the machine will do. Okay, so next comes is your so something about the pneumatic system which I want to talk about is like this safety disc works. In CS300 we have a dual head reciprocating, so that's how the compressor is on, and for the inflation and deflations. So the air is moved during the compressions, and in a newer versions, why in this is we have upgraded is like. We have heard a lot of noise and power consumption is more. So we have upgraded to a scroll compressor. This doesn't have any friction. It rotates like this, and so it consumes. It does not consume more power. It is very fast. Why fast is important is like as I told you, when somebody is having an increased heart rate, that's a different phenomenon. Okay. So you have a vent valve in CS300. At higher rates, it is automatically ejected, but in CardioSafe we don't have a vent valve, which can be because of the mechanism, because of the compressor, it doesn't need any vent. In your safety disc, if you see, it is made of aluminum. So we want to reduce the weight, so we did it with the plastic. And there is something called as condensate removal module. So why is like helium is a gas. Water vapor, so you need to remove the water vapor, otherwise it's going to dilute your helium. So you have something module called as condensate removal module. Uses a Peltier cooler, converts the water vapor into liquid, then drips into the cold trap. But in CardioSafe, in this mission, you don't have a CRM. There is no condensate removal module. Instead, we are using a technology called as a Nafion technology, where the helium is passes into the Nafion tube and it is the vapors are ejected automatically. So what are the components you can record is you can record an ECG, you can record an arterial pressure, and you can record a IVP waveform. So this is the on and off button which I'll explain to you, and we also provide a Doppler along with this IVP mission. What is the Doppler is? Doppler is like you can monitor the pulse, you feel the pulse, right? So if you go to a doctor, if you have a fever or something, he feels the pulse first. So when you're hypovolemic, that is like if you're almost in the fainting stage, you don't have any volume, you have severe diarrhea and vomiting, you cannot feel the pulse by hand. So when you use a Doppler, you can feel it. So that's why we also provided with the Doppler. Thank you. If you have any questions, you can ask me.
What the clinical professions actually does.
Okay. Do you have any slides? About ECMO therapy. So what is a perfusion technology? Okay. What do you mean by perfusionist? Actually, I'm a perfusionist. So what I do actually, my role is perfusion means blood supply. Okay. Anything. So how do I perfuse? Like as a perfusionist, what is my role is when I will put it in simple. Okay. When heart surgery is done. Okay. During heart surgery, what happens? The surgeon needs to operate on your heart, right? So you know that the only organ function keeps pumping. It keeps pumping and it keeps moving. So when it is keep pumping and moving, I will not be able to do a surgery, right? Because it's so disturbing for me. It is vibrating. So I want to make this heart arrest. Arrest means make it as a standstill. So when I arrest the heart, what happens? See, I told you heart is the organ which supplies the blood supply to all the parts of the body. All the organs of your body gets blood supply only from your heart. When I'm going to arrest this heart, so how is the blood supply maintained to other organs? See, I do a successful cardiac surgery and now the patient is not waking up. His neurological status is gone. Patient is into acute renal failure. Okay, patient has lost his limb. So what is the purpose of me doing a cardiac surgery, right? When I do a cardiac surgery, I have to take care of my other vital organs also. Okay. So what I do is when I'm arresting the heart, see, heart is like a vessel which holds a lot of blood. So what I'm going to do with all this blood? So I'm going to translate all the blood into an external system. We call it as a heart-lung mission. Okay. This heart-lung mission is going to. This is where you will be seeing all these heart-lung missions when you become a professionals. So this heart-lung mission, the function of the basic heart-lung mission is to do a function of the heart and lung. Okay. See, the heart function is to give so much of output. Okay. It is contracting. I showed it in my slide, right? It is contracting and it is giving blood to all the parts of the body. So for me, the cardiac output is different. For you, it's different. For sir, it is different. Okay, because it depends upon the body surface area. Okay. So we calculated the mission. So the mission is going to do the function of the heart, and we also have an oxygenator. Okay, because I'm going to bypass the heart and lung. Okay, lung also is not. The lung is being taken over by a oxygenator. So what is the function of a lung? The lung function is basically to. So of course, I don't know much about so much knowledge on your aspect. So the basic function of the lung is, is to purify the blood. To put it in simple terms, it has to oxygenate and remove the carbon dioxide, which is done by a semi-permeable membrane. So I have an artificial lung. I oxygenate, okay, and then the entire circulation is taken over by a heart-lung mission. So I bypass the heart. Okay, so this is the heart. I bypass the entry and exit. So there is no connection to the patient heart. I arrest the heart also. Heart is standstill. So my job is to take care of the function of the heart and also the function of all the vital organs. So which is very, very critical. If a perfusionist does any single mistake on the case, the patient will die on table. So because the entire function of the heart and lung is done by this perfusionist. The surgeons, they operate, they don't even see the monitor. The anesthetists, they manage the patient. Okay. So I have replaced the valve when there is a valve problem, or when I have a heart attack, I need to bypass. You would have heard the bypass surgery. That's very simple. So what is a bypass surgery is when I'm going in some route, if the route is blocked, I take the other route, right? When you're going, your route is blocked, so you have a traffic jam. So what do? You take the alternate route. That's a bypass surgery. I do an alternate. So everything is okay, I do a successful surgery, but if the patient doesn't come out, there is no point in doing a surgery, right? So that's the role of a perfusionist. Perfusionist means he has to maintain the perfusion, which is a blood supply to all the vital organs of the body. And he also should take care of the, myocardium. You keep your vegetables in fridge, right? Why you keep it in fridge? Because to decrease your BMR, basal metabolic rate. It should not decompose. That's why you keep it in fridge. So all your things are coming down. Same way I cool the patient. Okay, if your normal is 37, 28 degree, I preserve his myocardium. So when everything is okay, the patient slowly, I give all the blood to the heart, and patient slowly the parameters comes up. So that's the role of perfusionist. So maybe he will explain it when he has some slides and videos. Was I be able to clarify your doubts? Okay, thanks.
So much, sir. I now request our HOD, Dr. Amburajan sir, to hand over the memento to Mr. Gokul Krishna. Our next presentation will be by Mr. Lognath Desai.
Guys are awake right now. I don't want to make you all sleep again. Actually, everybody is cool, relaxed, boring, sleepy. I could see people on the last bench relaxing themselves. Actually, I'm a last bench student also. So I have noticed pretty much people actually was there in the beginning of the meeting, and right now they have moved out. And I don't think so. And you might be thinking, what the hell is going to talk about also? Like, what is there in the topic? And there is something also which is in the invitation saying that introduction and overview of ECMO. What is ECMO kind of thing? You might have thought about ECMO kind of. And I would say that, have you ever thought about, apart from your machines and your boards and your digital displays and all those things and all, have you ever thought about what happens when something fails inside?